I'm really glad to be here. So without making you guys wait any longer, let's get started. So the topic today is colorectal cancer screening. The short form is CRC. That's colorectal cancer. This is the month. March is the month of colorectal cancer screening, and it's the last day of the month. But we're still going to talk about it, and hopefully we can get a lot of people to volunteer for colonoscopies after this. So this is a general overview of what we're going to talk about. The first, a few things are going to be: how common is colorectal cancer? What is colorectal cancer? What causes it? What are the risk factors for getting this cancer? What are some of the symptoms that one can have? And can it be prevented? And are there any tests to find colorectal cancer early? And what you can do to decrease your risk of colon cancer? And a few more, and some more information at the end of the talk. So let's talk about colorectal cancer, about how common it is first. So it's the third most common cancer in both men and women in the US. And it's the second leading cause of cancer-related death in the United States for both men and women combined. So you can imagine it's right up there. Of all the cancers that you can think, this is number 2 and number 3 when it comes to how common it is and how fatal it can be if it's not caught on time. So it's estimated that maybe more than half, maybe close to 60% of cancer can be prevented if we do screening on time. And we'll talk a little bit more about towards the end as when one should get screened for this cancer. So this particular slide applies to our state, Louisiana, what the cancer prevalence is, and as you can see, it's number 3 when it comes to incidence of colon cancer, and it's number 4 when it comes to death from colon cancer. So it's of all the states, you can see the blue-colored states, the dark blue ones, and they have the highest incidence in the top map here. So the ones in the dark blue have a very high, some of the highest incidence of colon cancer right there. And here you see the actual death rates from colon cancer, and unfortunately our state is right up there with some of the other states. I don't know why the difference between Texas and Louisiana, they're right next to each other. Maybe the diet or something, I'm not really sure. But we do have a higher risk than Texas. So let's talk about what's the colon. We also call it large bowel or large intestine. It's a long tube. It's about 5 feet long, and it's part of your digestive system. And it absorbs water and salt from the food that we eat. And it stores the waste material. So it stores there until you feel the urge to go to the bathroom. And the rectum is the last 6 inches of the colon towards the bottom. And that's a major reservoir where the stool is stored before we defecate. So it's all part. When we say colon cancer, we automatically mean the rectum is part of the colon. So what is colon cancer? This is just a very basic definition of colon cancer. It's basically a growth of abnormal cells. Something along the line goes wrong someplace. There's a trigger that we don't know exactly what that environmental trigger could be. Is it our diet? Is it maybe some chemical? Is it our genetics? Something goes wrong, and it leads to this abnormal tissue forming inside our colon and rectum. And that's how it starts. So we don't know exactly what causes it, but we know that some of the risk factors, and we'll talk about the risk factors a little bit more. But if you have one of those risk factors, it's very, very important to get colon cancer screening done on time. So as we think, it may be related to changes in our genetic material, in our DNA. At some point of time, a mutation happens. Sometimes we inherit it from our parents and grandparents, but sometimes you can have it de novo. That means something happened along the line, and we're the first ones to get that colon cancer. And then your children and your children after that will always have that higher risk of getting colon cancer. So here's some of the risk factors that can contribute to colon cancer happening. Some of it is very common sense. We start screening. Most of you guys know that we start screening at age 50, and there's a reason for that. As we get older, the risk of colon cancer goes up. So they did a lot of studies. They went back and saw who had colon cancer at what age, and they figured that the risk starts going up at age 50. And that's why we start screening at 50 and not earlier, unless you have some other risk factors that we're going to talk about. And one very important fact is that in African Americans, the incidence of colon cancer is much higher, so we start screening at age 45. So that's just a number that we have, that's an exception that we have to remember. So another very important fact is our diet. You know, there are certain meats, red meats, that increase your risk of colon cancer. So meats like, you know, some of our favorite foods actually, beef, pork, lamb, and processed meats like hot dogs, bacon, cold cuts, they all increase the risk of colon cancer, unfortunately. So all good things in life have a risk, if you have to remember. Fruits and vegetables are supposed to lower your risk of colon cancer. So we always encourage our patients who have a lot of polyps, or even if they don't have polyps and they ask us at the time of the colonoscopy, doctor, what can we do to decrease our risk of polyps? Why do we have so many polyps in our colon? We tell them, well, we don't know exactly why, but we think it has something to do with the diet. So if you try to lower your intake of meats, red meats, processed meats, and eat more vegetables and fruits, it may lower your risk of colon cancer. So physical activity is very important. The less active we are, the more your risk of colon cancer. So it's very important to get up, walk around, exercise a little bit, and it's supposed to decrease your risk of colon cancer. Smoking, alcohol, being overweight, having type 2 diabetes, just like everything else, all the other types of cancers, colon cancer is one of those cancers. You know, the risk is increased by doing all of these things or having some of these conditions, unfortunately. So here's some of the other things that we were talking about. You know, 50 is a good number to remember, 45 for African Americans. However, there are certain other conditions that can happen that really increase your risk of colon cancer. So what are some of these risks? These are people with inflammatory bowel disease, people with colitis, ulcerative colitis, Crohn's disease. We call them inflammatory bowel diseases. You know, it's a big umbrella term. Inflammatory bowel disease. It includes ulcerative colitis, it includes Crohn's disease. So patients who have this, their risk of colon cancer starts going up after 8 years of having these diseases. And we start screening them a lot earlier, and we do them more frequently as well, compared to, you know, in the general population where we screen every 10 years if there's no other risk factors. Just something to keep in mind, a lot of people confuse irritable bowel disease, or IBS. That term gets thrown around a lot. Everybody has IBS. So it's nothing to be, we shouldn't confuse it with inflammatory bowel disease. That's IBD, this is IBS. And although it says IBD there, but you know, irritable bowel syndrome and then inflammatory bowel disease are two very separate, different things. So what are some of the other risk factors besides having colitis? These can include people with lots of polyps on their previous colonoscopies. So if you've had a colonoscopy and it showed a lot of polyps, guess what? Your risk of having more polyps is higher. So you need to be coming back more frequently than every 10 years. Patients who have family members with colon cancer, mostly first-degree family relatives, you know, like parents, siblings, and not so much with grandparents and cousins and distal family members. And patients who have certain types of polyposis syndromes. That means, you know, they have lots of polyps, different types of cancers, including GI cancers. It's very important to talk to your doctor about that. My father had this, my grandparent has this type of cancer. Is there something going on? Maybe it's part of a bigger syndrome. And obviously people who have had colon cancer in the past. So you know, you may know we bring them in very frequently. So 1 year, 3 years, 5 years, and every 5 years after that. So there are protocols in place for patients for every different case. So if you have any of these conditions or any of these apply to you, you got to talk to your doctor and they'll refer you to a gastroenterologist. So what are polyps? You know, we talk about polyps of our patients when we do colonoscopies and they're like, doctor, what is a polyp? And it's hard to define what a polyp is, but just to talk about it in layman terms, it's a little growth. I'm not sure if we can see it very well, but It's like a little mushroom almost, and it grows inside the colon. So this is your colon, and there's one there, there's one there, and when we see these polyps, we take them out, we cut them out, and that's how we prevent colon cancer from happening. So basically, there's different types of polyps. So when we do your colonoscopy and we say, well, it depends on what the pathology shows, what type of polyps these are. That's what will determine when your next colonoscopy ought to be. Is it, are these completely benign polyps? In that case, you may even go for 10 years before your next colonoscopy. Are these polyps that we call adenomas or adenomatous polyps? Then these polyps have a higher risk of colon cancer. Sometimes doctors say these are precancerous polyps. So if the nurse calls you and say, we got a couple of precancerous polyps, don't be alarmed. These are just polyps that could have turned into colon cancer years down the road. So it's just different definitions of colon cancer. So colon cancer is one of those cancers. If we can diagnose it on time, we can take it out when it's in this stage right here. So this is your normal colon. It's like a tube, and in the tube is this little stalk, and it takes years for these polyps to form. They don't happen overnight. So if you get a colonoscopy on time, you can get this thing out before it turns into this here, which is a really ugly looking colon cancer. Unfortunately, once it gets to that stage over there, there's the chances of a complete cure goes down, and other treatments may need to be done. So what are some of the symptoms that one can have from colon cancer? Remember, very important, we hear this a lot from our patients in clinic. I didn't have any symptoms all these years, and I felt like I didn't need to get a colonoscopy done because I didn't have any problems. So we always have to explain to them that by the time you have any symptoms, for example, if you start seeing blood in your stool, if you start having any stomach pain, any changes in your bowel habits, any new onset of constipation or diarrhea, any weight loss without trying. By the time any of these start happening, it may be too late. That means the polyp has progressed to a cancer, and you don't want to wait until that happens. So how can you prevent colon cancer from happening? By doing regular screening. And what's a screening test? Just like a screening mammogram, a pap smear, a colonoscopy, and other tests that we can do to screen for colon cancer. It's a test that we do when people don't have any symptoms. That's what a screening test is. If somebody has a problem and then we do a colonoscopy or an upper scope, it turns into a diagnostic test. It's no longer a screening test. And it's very important for insurance reasons. If you get a screening colonoscopy, it may be completely free for you. If you get a diagnostic test done, you're going to pay that coinsurance and your deductible and all those good things, And so it's very important that if it's time to get a screening test done, you get it done on time without having any problems. So like I said, why do you screen? To find and remove polyps before they turn into cancer, and to find colon cancer early. Let's say even if it's progressed to cancer, we can find it early when it's small enough, when it hasn't gone outside the colon to other organs, and we can get it removed by surgery or some chemotherapy. It's a lot better than letting it just get bigger. So what are some of the colon cancer screening tests that we do? So there are two big categories of tests. There are tests that can find both polyps and cancer, and there are tests that mostly look for cancer, okay? So the tests that look for both polyps and cancer, they include these 4 tests here. And obviously colonoscopy is what we prefer because it's a gold standard. If you have the chance, if we can do it, get a colonoscopy done. Because that's the only test that looks inside the complete colon, and we can remove things or we can biopsy things while we're in there. Some of these other tests, for example, the top one, which is a sigmoidoscopy, it's like a mini colonoscopy. Just looks inside the rectum and a little bit beyond. So it can miss a lot of cancers in the very end of the colon. This thing here, it's called double contrast barium enema. A lot of patients may be familiar with barium enema. It's not the most exciting test to get done. It's pretty brutal, actually. It hurts a lot, and a lot of patients show up for colonoscopies saying that they had a barium enema done and it was very painful, and it brings bad memories, and people associate that a colonoscopy may be just as painful as getting a barium enema done. But it's completely opposite. It's nowhere close to this. And we're going to talk about these tests in a little bit. And there's another test called a CAT scan. It's a special type of CAT scan. It's a CT colonography. It's a very new technology. Not too many places have it. I tried to order one when I was at UTMB Galveston. We didn't have it. We had to send the patient somewhere else in the medical center. So not too many places do this. And radiologists may not be very comfortable doing this test at this point of time. So remember, we can do any of these tests. Every case is different. We have to, patient choice is very important as well. We talk about these options, but if it was up to us, we would prefer a colonoscopy because it's a more complete and thorough exam. So what exactly is a colonoscopy? It's basically a very thin, lighted tube that goes inside through the anus and into the rectum, and then it goes all the way into the colon, all the way to the end of the colon. And that's where that's the appendix, and the small intestine is there. So we look very carefully inside the colon. We look for polyps, and if we see any polyps, we can take those polyps out. And remember, this is the only test that allows biopsy or removal of the polyp at the very same time when we look at it, when we see it. Some of those other tests that I had talked about, for example, the barium enema or the CAT scan, it only looks. They'll tell you there's something going on, it may be a polyp. The only way to take a polyp out is by doing a colonoscopy. So instead of maybe getting 2 different tests done, maybe just go straight for the one and the most important test, which is your colonoscopy. And I didn't know about this before, but I just found out when I started practicing. Let's say if you get one of those tests done that they send you with a card and it comes back positive for blood and you come in for a colonoscopy, the insurance looks at it as a diagnostic test, not a screening anymore because it came back positive. So, yeah. So colonoscopy. If polyps are found during the exam, we have little tools that we can pass through our scope, and they can come out, and we can take polyps out very easily. And that's how we prevent colon cancer from happening, by taking them out on time. So this is the barium enema that I was talking about. It's a substance that looks white on X-ray. So when you do an X-ray, it lights up like this. So what it does is that it's basically coating the colon, and if there's any big polyps, any big tumors, the radiologist will let us know. So it's put in through the rectum, into the rectum through a plastic tube, and basically they fill the entire colon up with the barium, and then they do a series of X-rays and they let us know, if there's a big polyp or tumor. But sometimes the small polyps can be missed on this study. It's not the perfect study. What is a CT colonography? This is that new test that I was telling you about. What they do is they pump air into the colon through a small tube that's inserted into the rectum. And then CAT scans are done, and a special computer program creates a 2D or a 3D, a three-dimensional fly-through view of the inside of the colon. Something like this. Looks like a little video game, and you look for polyps, and which lets the doctor look for polyps and cancer. So guess what? You still have to show up for a colonoscopy to get these polyps out. But it's a good test for somebody who's real sick, who doesn't want to undergo a colonoscopy. Maybe we can do a CAT scan, and if it shows anything, at that time we can bring somebody in for a colonoscopy. So it's all based on patient choice and their particular situation. And these are some of the other tests that I was talking to you about. These tests are less invasive compared to a colonoscopy or a CT scan or a barium enema. All you have to do is, there are special tests. This one is based on detecting occult blood. Occult meaning hidden blood. You don't see it, but it may be there. And that's how, so you have to do this test every year. It's a little card, and you apply some stool smear on it. And if there's any blood in the stool, this card picks it up. And there's more newer tests which actually check for DNA inside the stool. And the thought process behind this is, when you have a cancer, because remember, these tests are more accurate when you already have a cancer. So the cancer is already leaking blood or leaking abnormal DNA, and these tests basically detect the DNA or that blood. So that's the reason these tests are not very good for looking for polyps, okay? Because polyps are they can grow for a long time, for many years, before they start doing all these things. This is that flyer that we mailed out, I think, a couple of weeks ago, talking about one of the free at-home screening tests. It's that card test that I was talking about. So if that card test comes back positive, you need a colonoscopy. That's the next step. So here's some of the screening guidelines. So we start screening both men and women at age 50. And as I mentioned before, some of the tests that we can do are the little mini colonoscopy every 5 years, a colonoscopy every 10 years. Remember, this is only if it's completely normal. Double contrast barium enema every 5 years, or a CT colonography, which is also called a virtual colonoscopy, every 5 years. So, and again, a colonoscopy would be the preferred or the gold standard if you ask a gastroenterologist. And these are the other tests that detect mainly cancer. So we can use these tests in people who are really sick, who can't undergo any of those other tests that I had mentioned. At least we can make sure they don't have anything terrible by checking a stool test for blood or for abnormal DNA. And adults who are at higher risk for colon cancer, that's the group of people who had colitis or family history of colon cancer, lots of polyps in the past. You need to talk to your doctor and see if it's time for you to get screened to get another colonoscopy done. And the American Cancer Society has specific guidelines. So if you go on their website, they will actually tell you if you have this problem, you need a colonoscopy this often, this frequently. And the American College of Gastroenterology recommends starting screening in African Americans at age 45 rather than 50. So what can you do to prevent and beat colon cancer? So stay at a healthy weight, be active, exercise as much as you can. They recommend at least 150 minutes of moderate or 75 minutes of vigorous intensity activity per week, or some combination of thereof. You have to eat right. You have to eat more fruits, vegetables, less processed meats, whole grains. All those things decrease your risk of colon cancer. And obviously alcohol for everything else, pancreatic cancer, stomach cancer, you name it, esophageal cancer. Alcohol increases your risk of many different types of cancers. So basically what they recommend is no more than 2 drinks a day for men and 1 for women, which shouldn't be too difficult to do, I think. So what can you do? If you're age 50 or older, get tested for colon cancer. Talk to your doctor about what screening test may be best for you. Talk to your doctor about your medical history, about your family medical history. Maybe you need to get started screening earlier than 50. Screening tests offer the best way to prevent colon cancer, or at least to find it early enough where we can get it out. It gives you a better chance of a successful treatment. And remember, early cancer doesn't have any symptoms, so don't wait for symptoms to occur. Treatment is most effective when cancer is found early. And I always like to tell my patients, if you have the choice, go to a gastroenterologist to get your colonoscopy done. Because gastroenterologists are trained just for this. We do thousands and thousands of colonoscopies in our training before we start doing colonoscopies on real patients. We get a lot of practice, unlike some other specialties, which may not be focused on colon cancer screening that much. So you always have to find a doctor who does a lot of colonoscopies, and very soon these are going to be public records. You can go on the website, you can find out which doctor has done how many colonoscopies, how many polyps they find every time they do a colonoscopy, what are their complication rates, and they can include bleeding, perforation, things like that. And that's it. This was a nice video. I was actually in the video, but we're not going to be able to watch it because of the internet problem. And I got some of this information from American Cancer Society. So, any questions? Very quiet crowd. Yes.
I was told that I didn't have to have one after 75.
I'm glad you brought it up because I didn't get a chance to mention that. So we generally do colonoscopies up until 75 to 80. That is the gray zone from 75 to 80. After 80, the risk of complications go up mostly because of anesthesia. Not so much from taking a polyp out or otherwise. It's because of the anesthesia we get worried because your body's ability to sustain those medicines when we put you to sleep goes down after 80. But 75 to 80 is fair game. So if you're pretty healthy, if you don't have too much extensive cardiac problems or lung problems, we can do one.